Funding for Yale Cancer Answers is provided by Smilow Cancer Hospital. Welcome to Yale Cancer Answers with Dr. Anish Chagpar. Yale Cancer Answers features the latest information on cancer care by welcoming oncologists and specialists who are on the forefront of the battle to fight cancer. This week, it's a conversation about how to recover a sense of style after cancer with Sonya Keshwani. Sonya is a breast cancer survivor and founder of StyleEsteem Wardrobe, and Dr. Chagpar is a professor of surgical oncology at the Yale School of Medicine.
Sonya, maybe we can start off by you telling us a little bit more about yourself and your journey and how everything started for you.
My second act in life, as I like to call it, was with my cancer diagnosis. But with the life that I was leading before, I was working in Washington, D.C. as a federal government employee in national security. And I was at the height of my career thus far at the age of 29 when I was diagnosed with the early stage breast cancer. I received a diagnosis of a stage 1 triple positive breast cancer. And I was the first person in my family to go through such a diagnosis. I didn't know anyone in my family who had been diagnosed with breast cancer before me. And like many things in life, you know, being a child of immigrants, being the first to go to college, the first to have this type of a career, unfortunately, I was also the first to go through a breast cancer diagnosis.
I can only imagine being 29, you know, you're in a professional career in Washington, D.C., no family history of breast cancer. How is it that you got diagnosed? Can you kind of talk about how this was discovered and kind of walk us through that journey?
Sure. I discovered my breast cancer myself, and basically it just happened on a very routine day. I was taking a shower, and during that shower, I noticed something that felt really unusual in my left breast. And it was different because I'd never felt something like that before, ever. And so I immediately brought it to the attention of my mom, and then we pursued more questions with a community doctor. And basically, my doctor was really supportive, and he referred me to the right people pretty immediately for, taking scans and doing a biopsy. And I pretty quickly got my response that it was indeed breast cancer. But along the way, I was told that this may potentially be benign. You're very young. It could be just a benign cyst or just the typical lumps and bumps that some women have. But having never felt that before, I knew that I had to pursue an answer and to find out what this actually is. So something that started off as just another day taking a shower turned into something quite different at the end of it all.
Yeah. Yeah. So I think one of the important points is, going back to your job in national security,
Sure.
If you see something, say something. And if you feel something, say something, right? So I think your story, the first real take home point is to be an advocate for yourself and really, go to your doctor and get the answers that you need. I guess the next question is, it is unusual, not impossible, clearly, but unusual for somebody so young to be diagnosed with breast cancer, particularly without a family history. Did you pursue genetic testing or counseling, or how did all of that go?
Sure. I'm so glad you asked me about this question because it's such an important question to know your genetic history. For me personally, I think I'm the first person in my family to get genetic testing, especially as it relates to cancer. And during my testing, I learned that I actually carry a very rare mutation called BARD1. And it's something that at the time that I was tested was something that was being very newly tested. So there wasn't that much information about it. They suspected there is a elevated risk for breast cancer, not as high as like the BRCA gene, but some elevation to be of interest to researchers. But a few years have passed since then and more research has come out. But at the time, they weren't even able to advise me decision making of surgeries or treatment based on that mutation because not much was known. And since then, more research has come out, but I have yet to meet someone else who carries that same mutation as I do. So that is something that I learned about myself, and pushing my family to get tested has been also kind of a challenge, but it's something that I'm working on because I do think it's so important, not just for those of us who are here, but for future generations to understand their own risk as well and to take proper steps in their lifestyle and their health to have the best, the healthiest, and the longest life.
Yeah. And we now know that BARD1 really does increase your risk of breast cancer. It is, as you say, less common than the BRCA gene mutations. But, and I guess the other thing is all family histories have to start with someone.
Sure.
And in your case, I guess that starts with you. You mentioned taking proactive steps. So did your doctors or did you decide to change things about, your lifestyle, your diet, your exercise? I mean, or were you already pretty healthy and we're just going to keep going with what you were doing? Or how did this diagnosis kind of affect your life?
Sure. I think, when you get diagnosed, everyone goes through that period of time where you're kind of cleaning out your pantry, your fridge, you're really just looking at the back of every single product label, whether it's your shampoo or, your lotion or maybe the oil spray that you use in your cooking, whatever it may be. And being someone who was healthy, I would consider myself as being healthy before. I really took a deep dive into my life, and I had to have some really honest conversations with myself. And it took a lot of understanding about what we put in our bodies and how those ingredients affect us in our endocrine health and our hormone balance. Those are the things that I really dove into because that is the type of breast cancer I had. I had a triple positive, hormone positive breast cancer. So I really didn't have an understanding of how hormone health worked. And so I tried to look at everything in my home from that perspective because being healthy is one thing, right? Like following those very best practices guidelines, but that still doesn't necessarily address your specific health issues. So for me, it was hormone health, and I let that kind of be the guideline as to how I'm going to reevaluate my approach to my health.
Mm-hmm. So let's go back to, your diagnosis. You find this lump, you go to your doctor sends you on and you get scans. Presumably you got a mammogram and an ultrasound, and then they did a biopsy and they found this fairly early stage triple positive breast cancer. What happened then?
So basically, I was coming to New York for all these appointments because that's where my mother and my father live. And also, my sister is 19 years younger than me, but she was about 10 at the time. And so I wanted to go to these appointments with family, but my family was in New York and they were unable to travel so frequently to DC. So I started coming up to New York and going to all these appointments. And when I found out about my cancer, when I got that, that conversation that you get that it is indeed cancer, my parents had actually come to DC to my apartment to talk to me about it. As soon as we had that conversation, we all went to bed, and the next day we got up and booked our tickets back to New York. And so from there on, it started all the appointments that you go through when you are just about to enter treatment. So I had the conversation with my manager at the time that I will need to be in New York and I will let you know what happens next. But chances are I will need to take some time off and take some time off regularly in the future. And so at that point, it was just a matter of understanding what my treatment protocol was. We met with my surgeon, my cancer surgeon, my plastic surgeon, my oncologist, the genetics counselor, and we really tried to just get a plan of action and to move forward. And I was pretty quickly from then on the turnaround was pretty quick for me to get into the infusion chair, which then kicked off a year of treatment, including 6 rounds of chemotherapy with Taxotere and carboplatin, and 1 year of Herceptin and Perjeta. And of course, the surgeries in between that also, were part of the plan.
Just going back to one of the things you mentioned, you had talked to your manager and said, I need time off. How was that received? Because I can imagine that some people who may be listening to this may be a little bit scared, or maybe facing a little bit of trepidation to talk to their bosses about how that might be received, and might be wondering, how do I balance my work and my health? Can you talk a little bit about how that was received and what that was like?
Sure. My manager, thankfully, was a really kind and understanding person. I personally had decided that even though I'm going to go through this really tough time for the next year, that the way that my career made me feel, that it would actually benefit me personally to keep working. And so I wanted to work from home like 1 week out of the month. Every time I came up for treatment, every 3 weeks, I wanted to do my recovery week while working from home. I didn't want to take that week off. So I had that conversation that this is something I want to continue on with, and I don't want to take more time off than I need. But that was my decision. It helped me in terms of even my mental health to keep working. And so you have to really decide, you have to have an understanding of what benefits you the most. If you need to take more time off, then take more time off. It's really about putting your health first and about understanding what will help you heal the fastest, because that's the most important thing. I know jobs are incredibly important, especially with the health insurance that, a lot of us get with our job. But at the end of the day, health insurance and income don't matter if you don't have your health. And so you should look at the people around you as people that you can sort of add to your plan of how you're going to get back to your healthiest state. And you should see if there is a way to have your manager or your coworkers be part of that plan too. I think if you see them that way, maybe that will help you have a little bit more of a strategic approach and a more comfortable approach.
Yeah. And I agree with you. I think that so many people really find that getting back to work, getting back to a sense of normalcy is so important. And so thankfully, many people can work through treatments and take the time that they need off. And so having that conversation, oftentimes I find that people can actually be pretty surprised about how supportive their managers and their coworkers can be when they're going through a difficult time. So back to the story. So you meet with your team, a fairly large team of cancer surgeons, plastic surgeons, medical oncologists, genetic counselors, and you start mapping out a plan, which is going to include chemotherapy as well as surgery. Well, we want to hear all about that journey, but first we need to take a short break for a medical minute. So please stay tuned to learn more about Sonya's story with my guest, Sonya Keshwani.
Funding for Yale Cancer Answers comes from Smilow Cancer Hospital, where their survivorship clinic is a resource for cancer survivors and provides patients and their families with information on cancer prevention, wellness, supportive services, and health research. SmiloCancerHospital.org. The American Cancer Society estimates that over 200,000 cases of melanoma will be diagnosed in the United States this year, with over 1,000 patients in Connecticut alone. While melanoma accounts for only about 1% of skin cancer cases, it causes the most skin cancer deaths. But when detected early, it is easily treated and highly curable. Clinical trials are currently underway at federally designated comprehensive cancer centers, such as Yale Cancer Center and at Smilow Cancer Hospital, to test innovative new treatments for melanoma. The goal of the Specialized Programs of Research Excellence in Skin Cancer grant is to better understand the biology of skin cancer with a focus on discovering targets that will lead to improved diagnosis and treatment. More information is available at yalecancercenter.org. You're listening to Connecticut Public Radio.
Welcome back to Yale Cancer Answers. This is Dr. Anise Chagpar, and I'm joined tonight by my guest, Sonya Keshwani. We're talking about her journey with breast cancer and recovering her sense of style. So, right before the break, Sonya was telling us that when she was 29 years old, at the height of her career in Washington, D.C., she had a shower like any other day of the week. But this time she felt a lump, and one thing led to another. She ended up getting a biopsy that showed a triple positive breast cancer. And that led her down a treatment path to include chemotherapy, surgery, and more. So, Sonya, tell us about how that kind of started. Did you start with chemotherapy? What was kind of the discussion about that? You had found this fairly early. Talk to us about kind of what happened after the diagnosis in terms of your treatment.
Sure. So from the diagnosis to the treatment was a pretty short lead time where my doctors had let me know that they thought it would be best if I started with treatment first, at least the first 6 rounds of chemotherapy, which would have been Taxotere and carboplatin, along with Herceptin and Perjeta, which would go on for a year, but to take a break after the first 6 rounds and to have any surgeries at that point. And I personally was advised that given my stage of cancer that I could do lumpectomy and radiation, but I just wanted to go ahead and do a double mastectomy because I wanted to kind of have the best prevention that for myself that I had available to me at the time. I decided that this experience going through it once is more than enough for me. And if I can avoid going through it a second time, that I would try to do that. So I took a break in my year-long treatment to do my surgeries. And as soon as the mastectomy was done, I started back on the Herceptin and Perjeta, taking breaks along the way to do my revision. And I had 2 revision surgeries, so that those required breaks, but basically it continued on for a whole year.
So it starts with chemotherapy, and talk to us about what that experience was like as a 29-year-old newly diagnosed. I mean, without a family history, this must have been kind of a bit of a shock in terms of, oh my God, like yesterday I was going to work in Washington, D.C., doing my thing. And now I'm 29. I've been diagnosed with breast cancer and I'm sitting in an infusion chair.
I had never really been sick before my cancer diagnosis, so I was used to going to maybe my annual exam, maybe a dental appointment here and there. I was certainly not prepared for what it felt like to go to all these appointments. And very quickly, I began to feel like a body in a chair or like a human petri dish just being sent for one test and another. And so I felt myself getting very dehumanized because I just didn't know the sort of greatness of what was ahead of me. And each day I kind of found out a little bit more about that. But in a way, like we said, I didn't have a family history. So I also wasn't as educated about cancer from my personal side. And so I kind of leaned into this not knowing about what was going to happen by deciding that whatever it is that's going to happen, I'm going to tell my own story about what I'm going through. And so I started to actually go to treatment. And each time I'd go to treatment, I'd dress up as a new persona, a new character. And I would go in and I would just have I would draw the curtain and I would ask my mom to take pictures of me because I was all dressed up. And that helped me really kind of, lean into this mystery of what I was going through, but also the mystery that was within myself. I really had to kind of allow myself to meet new versions of myself every day. And so being 29 and having gone through this cancer diagnosis, I really wanted to not have it define me. I wanted to define what it was going to be in my life. And so when it came to dealing with side effects, I think that same mentality really served me well because it helped me write my story. And so I went through a lot of the side effects that I was told I would go through, right? So nausea, not being able to taste food, going through also just some extreme loss of stamina, a lot of fatigue. And there were so many of these side effects, but all of these side effects felt like they were a side effect of the medicine. And the one side effect, which was hair loss, that felt different, felt like it was personal. And so that was the side effect that kind of led me down a whole different path, which is really changed the course of my life, having gone through chemotherapy and hair loss, because it allowed me to understand that up until 29 years of living, that women are really told by the world who they are and what they can be. And I felt like as a cancer patient, I wasn't really being given positive messages. And especially after, hair loss, which is really that universal symbol about cancer patients. If you know nothing else about cancer patients, you know that they go through hair loss. I felt like I was outed to the world as something that was defined by society as being perhaps weak or just in kind of a low point in life. And I really wanted to not just change how I viewed myself, but also to change how the world viewed me. And that's how I kind of fell into this experimentation of designing headpieces, where I just felt this need to wear something stylish and comfortable that felt inspiring to me. And so I started to create my own headpieces. It was this ritual that was kicked off by the side effect. And what started off as like a mental health respite after each round of treatment, going to the fabric shop and spending some time getting lost in the aisles of fabric and seeing different textiles and dreaming about the future of where I would wear them and what those memories would be like. That launched what started off as a collection, a personal collection of turbans that really made me feel more connected with myself and my identity. And it just made me want to help other women have that same experience of being proud in how they look and how they're dressing, and writing their story in a way that is authentic to them through their fashion.
Did you have a background in fashion design? I mean, this whole idea of kind of getting dressed up to go to your chemo appointments, I can only imagine that many people kind of might feel like, oh, I got to go to chemo. I really don't want to go. I don't want to get dressed. Whereas I think you took this approach of, okay, so I'm going to go to chemo. So let me see, what am I going to wear today? And then this whole idea of, which headpiece am I going to design for my next chemo? It seemed refreshing. Was this something or was this like a pocket hobby that you had? Tell us more about the genesis of this.
Sure. So I always had this dream in me as a child that I wanted to be a fashion designer. And in fact, I wanted to design couture. And, it was this wild dream that I had that my parents, on the one hand, they loved that I was so creative, but on the other hand, they really wanted me to secure my future and at least go to college and get a degree that I could fall back on in case fashion, didn't work out for any reason. And so for me, the other thing that I was really passionate about was government and seeing people like myself in decision-making positions in this country, because I grew up in New York during 9/11, and I was I was at a point where I was thinking about what I want to be when I'm older. And that experience really impacted me and the way that I saw the world. And so that's how I ended up in Washington, D.C. But being a born and bred New Yorker, I had always had a love for fashion. And because I ended up in DC, the fashion really took on more of a personal styling note, where I always kind of was that unique person in the office, to the point where when I did lose my hair and I temporarily was wearing a wig, because that's the only solution that I thought I had, people didn't even realize that I was in treatment. They thought I had just gone to the hairdresser and gotten a new look, and people were actually complimenting me on my new hairdo. So I was that person that kind of owned everything about myself and carried it off with great pride. And that always showed in how I dressed. And so basically when I started down the path of treatment, I thought to myself, this is not the time to let go of yourself. This is the time to lean into it and to become more of it, to become a concentrated version of the best things about yourself. And so it's also a great sort of intention to have, but with full disclosure that it's really hard to show up for yourself during that time. I decided that I wouldn't always necessarily think of it as I have to show up for myself. Sometimes I would think of my mother who was sitting next to me for the full day of infusions. I would think of all the nurses who were so incredible and who took such great care of me. I would think about what they get to look at, right? So I wanted them to feel like all the effort they're putting into my life and into my treatment and healing, that it's paying off. And I wanted them to see the result through how well I was dressed and how great I looked. And I wanted them to feel proud of themselves for being part of my journey and for doing such amazing things to help me get better. And so I also like to think of it as I'm kind of a token of their hard work. And that is kind of how my outfits manifested as well.
Yeah. I mean, it's so great, right? That I love that phrase that you want to become a concentrated version of the best things of yourself. And I find that so many of our patients actually do. They take their diagnosis as this moment in time, a teachable moment, a moment that is that light bulb, that aha, that allows them to transform themselves, either doing something that they've always wanted to do or, taking a trip when they were always so afraid to travel, or getting out of bad relationships and into good relationships. It really is this time that allows you to take stock. So you start designing these turbans and these headpieces for yourself. Talk a little bit about how that transformed your life in terms of your day job.
Sure. So I had to have some honest conversations with myself about my career and try to understand where my purpose was. And, after a decade in government, I did feel a little bit like it was a good time to think about what comes next for me. And in that same moment, I did go through the cancer diagnosis as well. So that whole experience made me want to not just live my life in a more meaningful and conscious way, being more spiritual, being closer to my family in New York, and having more experiences where I felt like I was kind of living a little bit more fully, but also to have an impact on the day-to-day lives of people. Up until that point, I think I was working within an organization that had this very broad impact, and I really wanted to do some kind of work where I could impact people personally and individually. And so this idea for leaving my career in government and moving back home to New York City and launching my fashion label, it's something that I kind of decided to do because I figured, if I have the support of my family and if I have my health in this moment, then what could possibly go wrong? I mean, I'm creating something that clearly doesn't exist, that we need from not just a mental health standpoint, but also from an empowerment standpoint. It's something that I wish I had access to when I was going through treatment, and I can only imagine who else will be positively impacted by this. And so with that big idea, I decided to take that leap and launch my business. And, I would encourage everyone to follow that dream within their heart when they're going through this.
Sonya Keshwani is a breast cancer survivor and founder of StyleEsteem Wardrobe. If you have questions, the address is canceranswers@yale.edu, and past editions of the program are available in audio and written form at yalecancercenter.org. We hope you'll join us next time to learn more about the fight against cancer. Funding for Yale Cancer Answers is provided by Smilow Cancer Hospital.